Okay, so this is your scenario. Read it and then we will start our mock.
Okay.
So, can you explain the clinical picture of compartment syndrome?
Okay, local feature of compartment syndrome include pain, excessive pains, that is uh, disproportionate pain, paresthesia, numbness, and lately there may be pulselessness when it's less. That is left sign.
Okay, so what is the normal compartment pressure?
Okay, normal compartment pressure is from 0 to 15 millimeter of mercury.
Okay, so what are the indications for performing a fasciotomy?
Okay, indication for performing fasciotomy is where the compartment pressure is greater than uh, 30 millimeter of mercury, or clinically when there is severe pain, disproportional pain with anesthesia, and this pain doesn't usually improve with giving antibiotics, or when lately the pulse uh, start to diminish or disappear proximal to the, distant to the site of suspected compartment syndrome.
Okay, so other than lower limb, can you appreciate that is there any other part of the body that is likely to develop compartment syndrome?
Yes, other part of the body that can develop compartment syndrome apart from lower limb, uh, the upper limb and the abdomen.
Okay. So once you have decided to perform the fasciotomy, what will you tell the patient and their attendants regarding the procedure?
Well, I'll counsel the patient that there is risk of excessive bleeding, there is risk of nerve damage, permanent nerve injury, which cause current palsy of the nerve thereafter. There is a risk of excessive scar formation. There is uh, also risk of tissue loss. Limb loss. The limb involved, that is upper or lower limb. There is a risk of loss of that limb with what's called uh, amputation. The severe cases, this can occur in severe ischemic perfusion injury.
Okay. So can you tell me the reasons for the patient developing acute renal failure in this patient?
Okay, this patient can develop acute renal failure because of toxicity of myoglobin. This compartment syndrome will give rise to release of myoglobin. So the myoglobin, the excessive myoglobinemia, and is toxic and cause renal failure, acute renal injury because of its toxic effect. Another thing is that it can uh, accumulate. It can accumulate in the renal tubes and cause acute tubular necrosis because of the accumulation. That's separate mechanism. Another mechanism is that it can form some casts, myoglobin casts in association with acidic urine that might occur because of lactic acidemia. The ischemia will give rise to lactic acidemia. So the acidity in the renal tubules can form cast with the myoglobin, even if myoglobin is filtered, and it will block the tubules with subsequent acute renal failure. That is post-renal effect.
Okay. So can you define what is rhabdomyolysis?
Okay. Rhabdomyolysis is a breakdown of muscle fiber cells with subsequent release of the myoglobin in the blood and subsequent uh, myoglobin to the seat. in the body. It could result from injury, it could result from compartment syndrome, crush injury, or severe burns.
So, can you tell me about some of the causes for the development of rhabdomyolysis?
Okay. Causes of development of rhabdomyolysis include crush injury, compartment syndrome, severe burns, or long-term shock. Muscle damage, severe this strenuous exercise like marathon, which can also lead to that.
Okay, so can you tell me about the labs which will tell us about the diagnosis of rhabdomyolysis? What investigations will help you in the diagnosis?
Okay, the investigations include electrolytes. There will be hyperkalaemia, acidosis. There might be acidosis. Will be hyperkalemia. There will be uh, yes, lactic acidemia, and then there will be increase in creatinine level. There will be also increase in creatine kinase. Creatine kinase level will be high, and then creatinine also will be high. And yes, those are the
Okay,
common laboratory features that will be found.
so how will you manage rhabdomyolysis?
Okay, rhabdomyolysis can be managed by giving uh, a lot of intravenous fluids, rapid and super hydration with the aim of achieving very high urine output of up to 300 ml per hour in order to wash out the myoglobin that might precipitate and accumulate in the kidneys to cause urine, and to cause acute kidney injury, and then also alkalize the urine. Urine alkalization is also important in preventing uh, complication of myoglobinuria that might result from uh, rhabdomyolysis.
Okay,
And then I will, yes.
so how will you perform the alkalinization of the urine?
Okay, alkalization of urine, I will use sodium bicarbonate.
And what is the importance of this alkalinization?
Okay, this this alkalization of urine will prevent the uh, casts the urinary casts formation of myoglobinuria and acidic urine, because in rhabdomyolysis there is associated acidosis. So when alkalization has occurred, so that will prevent the formation of the casts that would subsequently give rise. The casts that will block the tubules and give rise to renal failure will be prevented by preventing acidosis in the renal tubules.
Okay. So what is ischemic perfusion injury?
Okay, ischemia repercussion injury is an injury that results from release of toxic metabolites into the system following long-term ischemia. When there is ischemia in a limb, like compression or tourniquet is applied, the ischemia, the ischemic limb will have cytokines release in the ischemic portion with obstruction, and the cytokines can get into the circulation if if the obstruction is released. So that will cause widespread injury of the other part of the body.